Hi, I'm Dr. Taatjes. Today we're going to talk about the road to recovery. So, most patients come into most offices, whether it's here or medical care, down here. All right, in crisis, suffering. As a patient gets treatment, a small percentage feel worse, no matter what kind of treatment that is. Some people excel through this area, but everybody has to go through these phases of recovery, phases of healing. During this time of care in the chiropractor's office, treatments are usually in close succession, maybe daily, maybe 3 times per week. If someone was seen, for example, in this phase once per week, they're probably going to stay right where they are. They may have a scenario where they're, I felt better for 10 minutes. Maybe they feel better for half a day, but they will never move all the way up this scale. In fact, they might actually keep going downhill, right? Now, when a patient gets to this point where they're feeling better, maybe symptoms gone, typically if they stop care right at that point, can they possibly be really well? No. If they stop there, they're usually going to go downhill, all right? We call a relapse. They may seek care again here, do it again, feel better, wait for a relapse. Anybody who's on this path, you can see that they're actually going downhill. Now, what I want to point out to you is that this really is the most common type of care out there. You know, this is what insurance companies like to pay for, all right? It's what insurance recommendations are. So unfortunately, this is what most chiropractic recommendations are. Now, this here is more of a specialty. This really is corrective, stabilizing, and restorative care, where we help patients get back to their full potential. Right? Now, once a patient is here, of course, they'll want to be maintained there. But this maintenance or wellness care, all right, is pretty easy to achieve. But this here takes a lot of work and repetition. And basically, an overall rule of thumb is the longer problem's been there, the longer it's going to take to go from here to correct. Right? Now, another thing that I want you to think about is, at what point should a patient seek out care? Unfortunately, we've really been taught in our society that come in down here when you're really bad, maybe after you've been hurting for 5, 10, 20, 30 years, then finally seek out care. Well, what if someone comes in right here instead? Maybe they don't even need an adjustment. Maybe they just need to be checked. Maybe they need one bone moved a little bit. Very easy to maintain someone here and never go through the discomfort and agony and cost and expense of all of this. All right? So there's a road to recovery. Thank you.